నమస్తే, వెల్కమ్ టు జీవన రేఖ. ఏట్రియల్ ఫిబ్రిలేషన్ అంటే ఏంటి, రావడానికి గల కారణాలు ఏంటి, ఏట్రియల్ ఫిబ్రిలేషన్ లక్షణాలు ఎలా ఉంటాయి, దాన్ని ఎలా నిర్ధారించాలి, అలాగే ఏట్రియల్ ఫిబ్రిలేషన్ లో ఎలాంటి చికిత్సలు అందుబాటులో ఉంటాయి, ఇవన్నీ తెలియజేయడానికి అమోర్ హాస్పిటల్ నుంచి కన్సల్టెంట్ ఇంటర్నేషనల్ కార్డియాలజిస్ట్ డాక్టర్ ఇమ్రాన్ గారు మనతో పాటు ఉన్నారు. వారిని అడిగి మరిన్ని సందేహాలు నివృత్తి చేసుకుందాం. అలాగే మీ సందేహాలను కూడా స్క్రీన్ పైన స్క్రోల్ అవుతున్న నంబర్స్ కి కాల్ చేసి నివృత్తి చేసుకోవచ్చు. సో నమస్తే డాక్టర్ గారు.
నమస్కారం.
సో డాక్టర్ గారు, ఏట్రియల్ ఫిబ్రిలేషన్ అంటే ఏంటి, అంటే కర్ణిక దడ అంటారు కదా తెలుగులో, సో అంటే ఏంటి డాక్టర్ గారు, క్లియర్ గా చెప్పండి.
See, normally our heart consists of two atria and two ventricles. There is a conduction system in the heart. Conduction system, in other words, is the current in the heart which regulates our heartbeat. Okay, our heartbeat usually is maintained in the range of 60 to 100 beats per minute. This is determined by something called as SA node. SA node is like the pacemaker in the heart. It generates impulses which are conducted throughout the heart, and that maintains our heart rate at a fixed interval. What happens in atrial fibrillation is the pacemaker activity is taken by atria. So there are multiple foci of atrial activation. It is not coming from the SA node. So what happens, multiple foci of atrial activation will cause an increase in the heart rate and irregular heartbeat. Okay, the atrial rate in such cases will be around 300 to 600 beats per minute, but the ventricular rate will be varying from 100 to 160 or even 200. So this irregular heartbeat is called as atrial fibrillation.
ఓకే, సో అంటే ఇది రావడానికి కారణం ఏమై ఉంటుంది డాక్టర్ గారు?
Okay, there are few causes of atrial fibrillation. The most common cause being hypertension, uncontrolled hypertension. Uncontrolled hypertension is the most common cause of atrial fibrillation. Other common causes are there. One among them is obesity, which is very common. There are some other diseases also which can cause atrial fibrillation. Any respiratory diseases like COPD or pulmonary hypertension, these can cause atrial fibrillation. In very rare cases, we get atrial fibrillation even in patients who are having heart blocks. Okay. Other common causes are any cause of heart failure. We call them as cardiomyopathy. Long-standing hypertension or long-standing heart disease which progresses into congestive heart failure, those can lead to atrial fibrillation. Okay. There are some reversible causes of atrial fibrillation also, like hyperthyroidism. Okay, any person with excess of thyroid hormone also can lead to atrial fibrillation. So these are some of the common causes of atrial fibrillation.
Okay, so అంటే ఏజ్ తో రిలేషన్ ఉంటుందా డాక్టర్ గారు ఇది?
Usually atrial fibrillation is not a disease of young people. It is more common in elderly people, you can say. It is not that atrial fibrillation cannot happen in young people. Even young people are prone for atrial fibrillation, but usually it is a disease of elderly, where because of long standing uncontrolled hypertension and associated coronary heart disease, these people are more prone for atrial fibrillation.
Okay, so దీనికి symptoms ఎలా ఉంటాయి డాక్టర్ గారు?
One thing to remember is atrial fibrillation many a time is totally asymptomatic. A person doesn't experience any symptoms, but they will be having atrial fibrillation. But the more commonly encountered symptoms, ante they will have palpitations. They tend to feel their heartbeat intermittently. Other symptoms include like fatigue, which is a very common symptom. They feel tired. Other symptoms are breathlessness, giddiness. So these are some of the common symptoms of atrial fibrillation. One of the most dreaded symptom which we don't want usually to encounter in practice is they directly come with stroke. A person is unaware that he has atrial fibrillation, and because of the complication associated with atrial fibrillation, they come with stroke. So sometimes the first manifestation of atrial fibrillation itself will be a stroke.
ఓకే, సో అంటే ఈ ప్రాబ్లం వచ్చినప్పుడు హార్ట్ రేట్ అనేది విపరీతంగా ఇంక్రీజ్ అవుతుందా, లేకపోతే విపరీతంగా డిక్రీజ్ అవ్వే అవకాశం కూడా ఉందా?
Usually atrial fibrillation is associated with increase in the heart rate. Okay. But if you give some medicines to control the atrial fibrillation, sometimes atrial fibrillation is also associated with lower heart rate. But as a rule, atrial fibrillation most commonly will have increased heart rate. Our normal heart rate is in the range of 60 to 100 beats per minute. So atrial fibrillation, it will be more. It can be 160, 170 if it is not controlled. Some cases of atrial fibrillation where it is associated with some other diseases called as WPW syndrome. In those cases, rate will be very high. It can also reach up to 250 beats per minute, your heart rate.
Okay. సో అంటే సిమ్టమ్స్ అంతగా ఉండకపోవచ్చు అంటున్నారు, మరి ఎలా డయాగ్నోస్ చేస్తాం దీన్ని?
See, any person experiencing these symptoms in the form of palpitations, giddiness or some fatigue, and they have some risk factors like hypertension which is not controlled, so they should undergo evaluation. Evaluation usually includes your routine ECG. ECG is one of the most common investigation, and that is like a definitive investigation for atrial fibrillation. So in ECG we can easily identify atrial fibrillation. Okay, some people what they have is called as intermittent AF or paroxysmal AF, that atrial fibrillation will last for some time, again it disappears, it reoccurs after some time. So these people are usually difficult to diagnose atrial fibrillation. So in such cases what we do, we get an extended ECG monitoring. Usually ECG is just we extend the ECG period of monitoring for a period of about 7 days, maybe 1 month also. So we connect the parameters or the monitors around their chest, which monitor their ECG continuously for a period of about 1 month.
1 month.
This is just to diagnose an atrial fibrillation. Okay, because it is tough to pick up if it is intermittent. Some cases of atrial fibrillation, they have persistent AF, like they throughout their day-to-day activities they will have AF. So in such cases diagnosis is pretty straightforward. A simple ECG can diagnose atrial fibrillation.
ఓకే, సో అలాగే అంటే దీనికి ట్రీట్మెంట్స్ ఏ విధంగా ఉంటాయి డాక్టర్ గారు?
Yeah, see, we should understand what will happen if we don't treat atrial fibrillation. Suppose if you don't treat atrial fibrillation, you can land up in stroke. That is the most dreaded complications.
Okay.
You will develop paralysis of any part of your body, right half, left half. So the aims of treatment of atrial fibrillation will be to control to prevent those stroke. Another thing, if atrial fibrillation is not controlled for a prolonged period of time, your heart starts to fail. That is called heart failure. That is called tachycardia induced cardiomyopathy. So these two things has to be treated. One is you have to control the rate. Another thing, you have to treat the atrial fibrillation, as that is called as rhythm control. So it has two things: rate control, rhythm control. So with rate control, we can bring down the heart rate to a manageable level, 60 to 100 range. That is called rate control. Rhythm control ante you have to try to convert this atrial fibrillation to normal rhythm, which is called as sinus rhythm. Okay, so atrial fibrillation has got rate control, rhythm control. Another thing which is very important in atrial fibrillation is to give anticoagulation. Anticoagulation are very powerful blood thinners. Okay, the aim of these medicines will be to prevent stroke. What happens in your heart when you have atrial fibrillation? There will be high chances of blood clot forming in the heart. So that is the reason these clots go into the circulation and they cause stroke.
Okay.
So in order to prevent the occurrence of these strokes, we give anticoagulation. So they have to keep taking oral medicines which will prevent these episodes.
Okay.
So treatment includes rate control, rhythm control, and also anticoagulation.
సో సర్జరీ అలాంటివి ఏమీ నీడ్ ఉండదా డాక్టర్?
Surgery is available, but it is usually difficult to control atrial fibrillation with surgery. Okay, there are surgical procedures which are called as catheter ablation. They just it just gives thermal current and breaks the circuit. Okay, but it is not so easily treatable like some other conditions. Okay, so it is difficult to control with radio frequency ablation for atrial fibrillation. Another thing, direct open heart surgery is available, but just for isolated atrial fibrillation, going for open heart surgery is not recommended. So some people with atrial fibrillation, they have heart diseases like mitral heart disease, mitral valvular disease, or aortic valvular disease. So these persons, when we are planning for surgery for this valve problem, at that time if they have AF, we can go ahead and correct the AF during surgery.
Okay.
So just to treat the atrial fibrillation, open heart surgery is usually not advisable.
ఓకే, సో లైక్ అంటే ఈజ్ ఇట్ ఇన్ స్టేజెస్, లైక్ నార్మల్గా ఒకలాగా ఉంటుందా లేదంటే స్టేజెస్లో ఉంటుందా డాక్టర్ గారు ఈ డిసీజ్ అనేది?
No, yeah. See, there are types of atrial fibrillation.
Okay.
There are paroxysmal AF and persistent AF. Paroxysmal AF ante the AF episode will last just less than 7 days. It comes maybe for 1 or 2 days. It lasts, then goes back to normal state. This is called paroxysmal AF. In some other cases, AF episode will last throughout, like it can last for more than 1 year. In that case, it is called as persistent AF. So different people during different course of time will have different types of atrial fibrillation.
ఓకే, సో అలాగే యాంటీకాగులెంట్ అంటే ఏంటి, దీనికి సంబంధించి సైడ్ ఎఫెక్ట్స్ ఎలా ఉంటాయి?
Yeah, see, as I told, to prevent the formation of blood clots in the atria and to prevent the development of stroke, we use anticoagulation. We have antiplatelets and anticoagulation. Antiplatelets are the routine blood thinners which we commonly use for patients post angioplasty or any patients with heart attack. These anticoagulations, they are more powerful blood thinners, you can say. Okay, the more the powerful blood thinners, the more the chance they can cause bleeding. So anticoagulation has to be given for atrial fibrillation. There are some scores which we calculate, either Chadwick score or Hasbled score. If the person fills this criteria for these scores, then we start this anticoagulation. Okay, there are new anticoagulants available. Earlier there were few anticoagulants which requires regular blood monitoring, like every 3 weeks a person has to undergo a blood test whenever we are using those anticoagulation. So nowadays the newer anticoagulations have come which doesn't require this blood test monitoring, and which have less chances of bleeding. So the most common complication associated with this anticoagulation is bleeding. Bleeding can happen anywhere. It can be as simple as a nose bleeding, or it can be very severe bleeding like your intracerebral or brain bleeding. It can happen bleeding over in the stomach also. So this is one of the dreaded complication of anticoagulation. To prevent this complication, usually we see the person has to be it has to fill the criteria so as to start this anticoagulation. Okay, we also calculate his bleeding risk by Hasbled score. If the score exceeds beyond a certain amount, then we don't use this anticoagulation. Only if the person has a low bleeding risk, then we prescribe this anticoagulation.
బ్యాక్ సో అలాగే డాక్టర్ గారు దీనికి ఓపెన్ హార్ట్ సర్జరీ అన్నారు కదా, ఒకవేళ టాబ్లెట్స్ తో కంట్రోల్ కాకపోతే సర్జరీ చేయాల్సిందని అంటారా?
Yeah, see, usually atrial fibrillation is treatable by medicines itself. Okay, so as I told already, the rate control, rhythm control medicines to control the rate and rhythm in case of AF, and also blood coagulation which will prevent your development of strokes and other things. Surgery only very rarely we indicate in presence of atrial fibrillation. Suppose a person has valve disease which is causing atrial fibrillation. There's some entity called as rheumatic heart disease where you get mitral valve disease, aortic valve disease. So these persons, if it is severe, this valve problem is severe, they can have atrial fibrillation. During that time when they are undergoing surgery for this valve problem, at that time we correct atrial fibrillation by surgery also. Okay, recently there has come a new device for treating this atrial fibrillation, that is called as LA appendage closure device. Okay, your atrial fibrillation, in one of the chambers of the heart there is blood clot formation. So with this device they just tend to close this chamber. Okay, this is the recent advancement in atrial fibrillation which we have. So this doesn't require a major surgery. This is just like a normal percutaneous procedure. Okay, with this procedure also definitely the chances of stroke and other things decreases.
ఓకే, సో అలాగే అంటే మీరు చెప్పినట్టు క్లాట్స్ వస్తాయి ఏట్రియల్ ఫిబ్రిలేషన్ ఉన్నప్పుడు అంటున్నారు కదా, సో ఇవి హార్ట్ లో అంటే బ్రెయిన్ కి కూడా బ్లడ్ క్లాట్ అయ్యే అవకాశం ఉందంట?
Yes, so this is one, as I told, this is one of the most common presentation of atrial fibrillation. The clot forms in the heart and that can travel to any part. It can go to brain, it can go to your peripheral limbs. So it can cause, if it goes to brain, you develop a stroke. If it goes to in the lower limbs, then we may require amputation also. Such is the severity of the condition. So the clots can migrate anywhere. If it goes to kidney, you develop kidney failure. Okay. So the main aim in atrial fibrillation will be to prevent these blood clots.
Okay. So అంటే paralysis వచ్చే అవకాశం ఉంటుంది?
Yeah, stroke is, in other terms, is paralysis. So if you the clot blows into brain, you develop a major paralysis.
ఓకే, సో అలాగే ఏ స్టేజ్ లో హార్ట్ అటాక్ వచ్చే అవకాశం ఉంది ఇది ఉన్నప్పుడు?
Atrial fibrillation usually is it doesn't cause heart attack by itself. Okay. But sometimes heart attack is associated with atrial fibrillation. When a person develops heart attack, in some of the types of heart attack we get brief episodes of atrial fibrillation. Okay, that is possible, but atrial fibrillation as such can lead to sudden cardiac death. That one should be very aware. Some cases of atrial fibrillation, as I told, they are associated with a syndrome called as WPW syndrome. Okay, when atrial fibrillation is associated with WPW syndrome, the heart rate tends to go very high, more than usual. It can go up to 250, 300, and it can degenerate into a condition called as ventricular fibrillation. That time, usually if we don't give immediate measures, then the person may die also due to suddenly they will expire just.
ఓకే, సో అలాగే అంటే మీరు ఇందాక చెప్పినట్టు థైరాయిడ్ కి దీనికి రిలేషన్ ఉంది అన్నారు కదా, సో ఏ విధంగా రిలేట్ అవుతుంది?
See, thyroid abnormalities in which we see in thyroid are an excess of thyroid hormone or a low thyroid hormone, that is called hypo or hyperthyroidism. Usually whenever the thyroid hormone is in excess, that is called as hyperthyroidism, those cases are associated with atrial fibrillation, and these are reversible causes of atrial fibrillation. If you treat the thyroid disease, then atrial fibrillation also regresses and it will come back to normal. So whenever a person has atrial fibrillation, we need evaluation at all the levels. We do blood test, we test for thyroid function test also, along with other investigation, ECG, 2D echo. So these will identify this problem and accordingly correct the atrial fibrillation.
ఓకే సో అంటే జెండర్ డిఫరెన్స్ ఏమైనా అంటే బాయ్స్ లో ఎక్కువ వస్తుంది మేల్స్ లో వస్తుంది ఫీమేల్స్ లో ఎక్కువ తక్కువ వస్తుంది అని ఏమైనా జెండర్ డిఫరెన్స్ ఉంటుందా డాక్టర్?
There is no specific age difference for atrial fibrillation as such, but some valvular heart disease are more common in girls, you can say. So in that accordance, if you go, slight atrial fibrillation risk will be more common in girls with valvular heart disease.
Okay.
Other than that, it is not, there is no specific sex predilection, you can say.
సో అంటే థైరాయిడ్ కూడా గర్ల్స్ కి ఎక్కువ వస్తుంది కాబట్టి
Correct.
సో దీని వల్ల కూడా వచ్చే అవకాశం ఉంది.
Usually girls, what we commonly see thyroid is hypothyroidism. That is a low thyroid hormone that is unlikely to be associated with atrial fibrillation. Hyperthyroidism can be associated, yes.
ఓకే సో అండ్ అలాగే ఇప్పుడు మీరు అంటే టాబ్లెట్స్ తో సెట్ అయిపోతుంది అంటున్నారు కదా, మరి టాబ్లెట్స్ వల్ల ఏమైనా సైడ్ ఎఫెక్ట్స్ వచ్చే అవకాశం
Yes,
అంటారా?
yes. See, as I told, there are tablets to control the rate and rhythm. Sometimes what happens when you try to control the heart rate, when we use excess of those tablets, your heart rate goes down. Sometimes it can go to dangerously low, maybe 30-40 beats per minute. So that is one of the side effect of tablet. It can bring down the heart rate, which you do not require. There are some other tablets which are called as like amiodarone or dronedarone. These tablets are used for rhythm control. When these tablets are used continuously in patients with atrial fibrillation, they tend to accumulate in the body and they cause toxic effects. They can cause lung toxicity. Your lungs can get damaged. They can cause corneal deposits. Your eyes can get damaged. So your liver can get damaged. So whenever a person with atrial fibrillation are on these tablets, we need to monitor regularly for the development of these toxicities in the body. So any person with these medicines has to go to hospital frequently, get checkup done by his pulmonologist for pulmonary function test, ophthalmologist to see if there is any damage to the eyes. This has to be done on a regular basis. So when any small sign of toxicity also, then we have to stop those medicines. So these are the drugs with some side effects for rate and rhythm control. Another anticoagulation, as I told, bleeding is a very common risk with anticoagulation. So any earlier we used to use anticoagulation which required regular blood monitoring. Every 3 weeks a person undergoes a test called as PT-INR. Okay, so INR has to be in particular range 2 to 3 when the person is on these anticoagulation. Suppose if the INR crosses 3, the risk of bleeding increases. If it is less than 3, the risk of clotting increases. So adequate balance has to be maintained. This is the reason when the person is on anticoagulation, frequent blood monitoring is suggested for him. Every 3 weeks or at least every month he has to undergo blood test. These are with older generation of anticoagulation. The newer generation of anticoagulation, we don't require this blood monitoring, but there is one caveat with newer generation is usually it is not prescribed for all patients with atrial fibrillation. The most common indication like valvular heart disease, usually these newer anticoagulations are not indicated. If the person has atrial fibrillation without any structural heart disease, only in these persons your anticoagulation with newer drugs is advised.
ఓకే సో అంటే మనం ఇప్పుడు చూస్తున్నాము సడన్ గా జిమ్ చేస్తూ కార్డియాక్ అరెస్ట్ అవుతుంది, సడన్ గా డాన్స్ చేస్తూ కార్డియాక్ అరెస్ట్ అవుతుంది, అంటే ఏజ్ తో సంబంధం లేదు. సో అంటే ఈ కార్డియాక్ సడన్ డెత్ కి సంబంధించి ఏఫ్ కి లింక్ ఉంటుందా డాక్టర్ గారు?
The most common reasons for sudden death in gyms and other things is usually not atrial fibrillation. Okay, these people usually will have some underlying heart disease that can trigger something called as ventricular tachycardia or ventricular fibrillation. It is a type of heart attack, you can say. This atrial fibrillation is a different entity. Okay, so there is no relationship between atrial fibrillation and those person who die of heart attacks in gym.
Okay, సో అంటే పర్టికులర్ ఏజ్ గ్రూప్ అని ఉందా డాక్టర్ గారు, అంటే లైక్ 30 above 40 above?
Usually it is a disease of elderly people more than 40-50 years because of long standing risk factors which are not treated. They tend to develop atrial fibrillation more commonly.
ఓకే సో అలాగే యాపిల్ వాచ్ కి ఈ ఏఎఫ్ కి సంబంధం ఏంటి డాక్టర్ గారు?
See, as I had already told, the detection of atrial fibrillation, especially if it is paroxysmal, it is coming intermittently, is very tough. Most of the time it remains undiagnosed. So the Apple Watch has been like US FDA approved to detect this atrial fibrillation. Okay, what happens is it monitors your heart rate continuously. Any irregular beats it detects. Okay, but there is some sensitivity and specificity with Apple Watch. And if you have some 100 people with atrial fibrillation, Apple Watch will not detect atrial fibrillation in all 100 people. It will detect in about 50 to 75 people. So 25 like persons are still there who have atrial fibrillation and which will not be detected by Apple Watch. Okay, but the specificity is high. Suppose if your Apple Watch says that you have atrial fibrillation, then the probability is that atrial fibrillation will be there is very high. So definitely, rather than when you are not getting diagnosed, wearing an Apple Watch to some extent can diagnose atrial fibrillation. Okay, but it is not 100% accurate, you can say. Okay, like an extended ECG monitoring which we do in our hospitals. If you put a Holter monitor for maybe 1 week or even 1 month, the chances of detecting atrial fibrillation will be very high. So Apple Watch, in spite of detecting in few cases, at least at 25% of the times it tends to miss those cases, especially if the duration of atrial fibrillation is very short. Suppose if the person is having atrial fibrillation, imagine just for 15 minutes, okay, those tend to be not detected by Apple Watch. So that one point you have to keep in mind.
ఓకే, సో అంటే యాపిల్ వాచ్ పెట్టుకున్నప్పుడు డిటెక్ట్ చేస్తుంది అంటున్నారు కదా, సో సమ్ కేసెస్లో డయాగ్నోస్ చేయడం కష్టం కాబట్టి ఈసీజీనే మనం 1 month పెట్టి ఉంచుతాము అంటున్నారు కదా. సో యాపిల్ వాచ్ కూడా ఇలా 1 month పెట్టి ఉంచడం వల్ల సమ్ కేసెస్ అంటే ఇక 10 minutes వచ్చి వెళ్ళిపోయిన వాళ్ళలో ఈ 1 month పెట్టుకోవడం వల్ల అలా డయాగ్నోస్ అయ్యే అవకాశం ఉందంటారా?
Yeah, see, the algorithm for atrial fibrillation, I'm not sure whether it just detects the atrial fibrillation episodes or the entire 1 month period. So we don't know how much data is stored in Apple Watch. Okay, here we can analyze each individual day also. When you are recording the Holter monitor for 1 month, any particular time of the day also we can just see what is the rhythm, and we can immediately identify. So definitely the sensitivity of Apple Watch is less compared to our conventional methods which we commonly use. So if you are having doubt of atrial fibrillation, I suggest not just to rely on Apple Watch, and to get a routine testing also very frequently. Yeah.
ఓకే, సో అండ్ అలాగే ఇప్పుడు చాలా మందికి సడన్ గా ఏదైనా వర్క్ చేస్తున్నా నార్మల్ గా కూర్చున్న సడన్ గా ఆయాసం అనేది ఎక్కువ అవుతుంది, హార్ట్ రేట్ అనేది సడన్ గా పెరుగుతూ ఉంటుంది ఏం వర్క్ చేయకపోయినా కూడా. సో అది రీజన్ ఏమై ఉండొచ్చు డాక్టర్ గారు, లైక్ వీక్నెస్ వలన లేకపోతే బీపీ వలన?
No, sometimes you see this sudden breathlessness and other things. Most of the times it is related to stress or something, which we commonly see. If it is really some breathlessness and really some palpitations, then that can be anything. Okay, any irregular heartbeat can cause palpitations. Okay, breathlessness and as such is a non-specific symptom that we have to see, individualize the approach for managing. Yeah.
Okay, సో అలాగే ఏట్రియల్ ఫిబ్రిలేషన్ కి సంబంధించి అంటే ఏదైనా డైట్ ఫాలో అయితే ఇది వచ్చే అవకాశం ఉండకపోవచ్చు అని ఏమైనా ఉందా డాక్టర్ గారు?
See, diet for atrial fibrillation will be like the risk factors diet, same thing. If you have hypertension, you have to control the blood pressure. So the diet for hypertension, salt reduced diet, okay, other things, regular physical activity. If your atrial fibrillation is because of obesity, you have to control the obesity, reduce your fatty foods, reduce high calorie food. So this is the normal diet. There is no specific diet for atrial fibrillation that will reduce the risk. Okay. But some people who are on anticoagulation, when they use, they have to be on a particular diet. They have to avoid green leafy vegetables. Okay, green leafy vegetables, when they are combined with your anticoagulation, the efficacy of anticoagulation decreases. So whenever the person with atrial fibrillation is on anticoagulation, we advise them to avoid green leafy vegetables. There is one particular diet which you can advise for atrial fibrillation persons.
సో చాలా మంది అంటే గ్రీన్ లీఫ్ వెజిటబుల్స్ తినాలి, అవి తింటేనే మంచిగా ఆరోగ్యంగా ఉంటామని చెప్పి కూడా అంటారు. బట్ ఈ ప్రాబ్లం ఉన్నా నిజంగా తగ్గుతుందని చెప్పి ఓన్ గా డెసిషన్ తీసుకుని కూడా తింటూ ఉంటారు కొంతమంది. సో వాళ్ళు అవాయిడ్ చేయడమే మంచిది అంటారు.
Yes, if they are on this older generation of anticoagulation which requires blood monitoring, then definitely they have to avoid green leafy vegetables. Okay, there is lot of interaction between these medicines and these drugs. The new anticoagulations which are coming up, these drugs have less interactions, so these people can consume safely.
Okay, so is there any prevention methods to అంటే ఇది తగ్గించుకోవడానికి ఏదైనా ప్రివెన్షన్ ఉందా ముందుగానే రాకుండా జాగ్రత్త పడడానికి?
Yeah, see, there are some things like if you do regular monitoring for your risk factors, a regular 2D echo. Sometimes what happens when your blood pressure is not controlled for a long period of time, your left atrium gets dilated and that triggers AF. So if you identify your blood pressure, do regular checkups, do a routine 2D echo, other things, you can make it out what is the left atrial diameter and other things. Controlling that will decrease the risk of atrial fibrillation.
Okay.
Okay, so basically it is the controlling the risk factors which will prevent the development of atrial fibrillation.
Okay. సో అంటే బీపీ ఉన్న వాళ్ళకి అది కంట్రోల్ కాకపోతే డెఫినెట్లీ 100% వచ్చే ఛాన్సెస్ ఉన్నాయా?
No, it is not just 100%. Very few people develop atrial fibrillation. The incidence of atrial fibrillation is very less, just 1 to 3%, you can say. So it is very, very less. But those people with whom it is very much uncontrolled for a long period of time, then the risk increases. Yeah.
Okay.
So not 100%, but definitely the risk will be more if it is uncontrolled for a long period of time.
ఓకే సో అండ్ అలాగే అంటే టాబ్లెట్స్ తో ఒకవేళ కంట్రోల్ కాకపోతే ఇంకా డోస్ పెంచి చేస్తారంట.
Yeah. See, as I told, the rate during atrial fibrillation has to be in a particular range, 60 to 90. Suppose even if there are 2-3 tablets for maintaining the rate. You add one tablet, you see the response. If it is not getting control, you add second tablet. If it is not getting control, third tablet. Okay. So you have multiple tablets to control the rate. Okay. With tablets, definitely your rate will be controlled. That's a good option. Yeah.
ఓకే రైట్, థ్యాంక్ యూ డాక్టర్ గారు. సో ఇది ఇవాళ జీవనరేఖ కార్యక్రమం. నమస్తే.